Hi everybody, I'm Holly with Delivering Hope. I am going to go over with you the injection part of the medications. Probably the most dreaded for all the surrogates, and one of the most commonly asked questions is, how do you give yourself a shot? Well, I'm here to help you with that. So I work for Delivering Hope as a case manager, but I'm also a nurse. So I have a lot of experience giving shots, and I'm very confident that after this video, you'll be able to give yourself a shot too. So let's first make sure we have all of our supplies ready. You will need your bottle of progesterone, obviously. You'll need your syringe, and you'll need 2 needles. Your clinic likely sent you 2 different needles. You're probably wondering, what the heck do I need 2 needles for? They likely sent you one needle that's a little bit bigger, probably an 18 gauge needle. Will look like this. This will be what you draw the medication up with. And then you'll have your other needle, which is the needle that you give your injection with. So mine are 25 gauge by 1.5 inch needles. So this is what I'll give the injection with. The 18 gauge is what I'll use to drop the medication with. And you'll also need 2 alcohol swabs. So the first thing you want to do when doing your injection is you want to take the progesterone vial and you want to scrub the top of it with an alcohol swab. This is to make sure that no bacteria gets into the medication when you pierce it with the needle, because then you can also get that bacteria into your skin as well and give yourself an infection. So make sure to scrub the top really well with that alcohol swab. Next step is going to be to take your syringe out, and you want to attach the 18 gauge needle to it. It's just a twist. Put it on and twist. And then depending on how much medication you're giving yourself, you're going to draw air up to that point. So maybe you're giving 1 milliliter of medication, maybe it's 0.5. Whatever the reproductive endocrinologist told you to do, draw that up in air. So we're going to take the cap off, and we are going to insert it, and you're going to push the air in, because we're taking a milliliter or however much you are taking out, so you want to displace that with air. So you hold it upside down, and then you pull back. I always pull back a little bit extra because there's always a little air bubble at the top. So if you pull back extra, then it gives you a little bit of wiggle room to push that little air bubble out. And if the air bubble is still there, flick it a couple times and it'll go up to the top, and you can just push that little air bubble out. So as you can see, I have 1 milliliter drawn up. Hopefully you can see that. And you can take the vial off. Okay, so we have that. Now what you'll do is you'll put the cap back on, twist the 18 gauge needle off, and then we're going to take the needle that we're going to inject ourselves with out of the package and twist it on. Now you have your dose ready to go. So now let's talk about injection sites. So where are you going to give the injection? Anything a milliliter or more needs to go in a big muscle. So you can't give it in your arm if it's 1 or more milliliters. So we have to go for a bigger muscle. So you have a couple different choices. One of them is in your thigh, and I'll show you exactly where that would be. So you have your leg, your thigh right here. You have a big muscle right here. Just squeeze up your muscle, and you can go right there. Or you can go in your hip area. So I always you want to go right about here. So kind of in line with your pubic bone. You do have a big muscle here. Or you can kind of have your butt. Your butt's a big muscle too. You don't want to go in your butt cheek. You want to go a little bit above it, kind of between your butt cheek and the lower back. There's this nice area right here, nice big muscle. You can go there as well. So how do you decide which injection site you want to go with? It's totally up to you. You guys, I've done these injections a lot. I did a mock cycle, and I did 4 transfers with my first surrogate journey before we got the baby to stick. So I've done these a lot. I've done them in my thigh. Ouch. The one in the hip I didn't like very much because, sorry about that. So I didn't like the ones in the hip because I'm a side sleeper. So, you're going to rotate your injection site. So I was doing one in the hip, and then I was going to the other side and doing that side. But I'm a side sleeper, so when I was sleeping at night, I could not get comfortable. So I started doing all my injections in the butt. And if you need more of a guide on where to give it, there's plenty of videos on YouTube, or you can pull up a chart, a picture chart that shows exactly where to give it. But That's where I go. And then I would just look in the mirror. You can take it off. You want your other alcohol swab, and you want to alcohol swab off a very big portion. And I always was looking in the mirror so I wouldn't stab a spot that I didn't already wipe off. So wipe it off really well. You're going to take the needle off and then dart it right in. You don't want to go really slow. You want to dart it just right in, and then push the plunger down, and that'll give you your medication. Like I said, you have to rotate sites. So you'd go on this side one day, on this side the other day. Pardon my little helpers there. If you get really sore in the butt area, you can always switch sides, switch injection sites. So do one in your thigh if you just need a break. I found the one in the thigh made it kind of hard to walk the next day, because every time I walked, that muscle would jiggle and it would hurt that where I had given the shot at. And then the one on the hips, like I said, they were kind of bothersome when I was trying to sleep. So the ones on the butt were the best for me. But do what's best for you. You can even try out different injection sites and see which one you like the best. If you need more help with the shots, or you just want some more coaching, reach out to us at Delivering Hope. I'm happy to do like a video conference with you. I can walk you through it, or whatever else you need, I can help you. Thanks for watching, guys.